MRI scans have long been considered a safe and essential diagnostic tool, widely used to detect everything from tumors to spinal injuries to neurological disorders. But recent research out of the University of New Mexico is raising disturbing new questions about the safety of the contrast agents used in many MRI procedures. These agents often contain gadolinium, a rare earth metal that helps sharpen images and improve diagnostic accuracy. While gadolinium was once believed to pass harmlessly through the body, new findings suggest this may not always be the case. In fact, under the wrong conditions, it can transform into something far more insidious: tiny, toxic nanoparticles that lodge themselves in organs and may trigger devastating illnesses. The catalyst for this transformation? Something as ordinary as a salad or a daily vitamin. The research, led by Dr. Brent Wagner and published in Magnetic Resonance Imaging, presents evidence that oxalic acid, a common component in many healthy foods and supplements, can react with gadolinium contrast agents inside the body. Oxalic acid, found in spinach, rhubarb, chocolate, nuts, and even synthesized by the body from high doses of vitamin C, is known to bind tightly to metal ions. It's already infamous for its role in the formation of kidney stones, but this study reveals it may also contribute to something far more dangerous: the creation of gadolinium-based nanoparticles. These particles, once formed, don't simply exit the body like the contrast agent is supposed to. Instead, they embed themselves into tissue, brain, kidneys, heart, skin, where they appear to set off a cascade of harmful cellular reactions. The most terrifying of these outcomes is nephrogenic systemic fibrosis, NSF, a rare but often fatal condition where the skin and internal organs harden, immobilizing joints and suffocating vital functions. The condition has claimed lives after a single dose of contrast, yet the factors that determine who is susceptible remain frustratingly unclear. What Wagner's team discovered may finally provide a clue. Through laboratory experiments, they observed that oxalic acid can essentially free gadolinium from its chemical bonds, causing it to reassemble into nanoparticles. These aren't inert particles. They're foreign invaders that provoke immune responses, chronic inflammation, and long-term tissue damage. This could explain the mystery of why some patients become severely ill after a single exposure while others have dozens of scans with no side effects. It's not just the gadolinium. It's what else is in your system when you're exposed to it. This has enormous implications because foods high in oxalates are staples in otherwise healthy diets. Spinach salads, almonds, berries, and dark chocolate are recommended for heart health, diabetes prevention, and cognitive support. Vitamin C is routinely taken to boost immunity and reduce inflammation. But when consumed near the time of an MRI, these same substances might be increasing the risk of nanoparticle formation and long-term gadolinium retention. The alarming part is that many people are never informed about this risk. MRI scans with contrast are often administered with little warning or dietary guidance. Patients are told they'll receive an injection for better imaging, but few are advised to avoid vitamin C or high oxalate foods before or after the procedure. Even fewer are made aware that gadolinium can remain in the body for years, silently accumulating in the brain, kidneys, and bones, potentially contributing to chronic fatigue, joint pain, memory issues, or skin thickening that physicians struggle to explain. This lack of transparency is more than a communication failure. It's a public health blind spot. With hundreds of thousands of contrast MRIs performed every year, even a small percentage of adverse reactions could translate into a significant population burden of unexplained symptoms and chronic illness. And while regulatory agencies have tightened guidelines around gadolinium-based contrast agents in recent years, no clear consensus has emerged on how to assess individual risk or prevent these nanoparticles from forming in the first place. The idea that a healthy diet could inadvertently amplify a toxic medical side effect is unsettling. So, is the reality that current screening protocols don't ask about oxalate intake or vitamin C use? The assumption that these agents are uniformly safe no longer holds up under scrutiny. Wagner himself now avoids vitamin C supplements before an MRI and advises others to do the same until clearer recommendations are available. His team is building a global patient registry to help identify those most vulnerable, gathering biological samples and detailed histories that might finally help trace the hidden connections between diet, metabolism, and gadolinium toxicity. Until then, the burden falls on patients and providers to ask more questions. Have you had previous contrast scans? Do you consume high oxalate foods or take vitamin C? Are you experiencing unexplained symptoms afterward? These are conversations that need to happen, not only to prevent unnecessary suffering, but to restore trust in a medical procedure that millions rely on each year. What this study reveals is not simply a rare interaction, but a fundamental flaw in how we assess medical safety. When the intersection of diet and diagnostics can create silent toxicity, we can no longer afford to assume that common procedures are harmless for all. Until more definitive guidelines are in place, caution is warranted, because what you eat and what you're not told may shape how your body reacts long after the scan is over.